Hi guys. So fertility is always a weird conversation. Infertility and sterility, being sterile, are two different things. Just because you're infertile doesn't mean you can't have children. It just means you have to do it a different way. Unfortunately, men with CF have an issue with their fertility, and that is because of the vas deferens being underdeveloped, and because of that you need to do some sort of sperm retrieval to get the sperm out. The partner will have to go through an IVF process to conceive, but we have the systems in place. And when you want more information as a person with CF or a partner of a person with CF, this is the video. You found the spot. What I'm really excited about is you get to meet my urologist, Dr. Coward. Wait till you see this guy. He knows a lot about the vas deferens. You get to meet Dr. Mary Peavey. Mary Peavey did not get my wife pregnant all 3 times, but she had a hand in it, that's for sure. When you try to understand what that process is and how it feels for a patient going through it, she is the person you want to go to. Go watch.
Well, let me tell you this. I got interested in taking care of patients with cystic fibrosis because they have one of the most unique problems in male infertility, which is this blockage that they're born with, it's one of the saddest things that I encounter because, they've already got a chronic illness. I mean, they've been dealt a difficult hand in life. And then to find out later when they go to get married that they have this fertility problem, I mean, it's heart-wrenching. And it's really correctable, but it requires a surgical procedure that requires precision. It requires a lab. It requires IVF. And so it's a complicated process. They need someone to show them how to do it, to walk you through the steps, and then to go through the IVF process. So it's a complicated process. And in my prior role at UNC, I saw a lot of patients with CF. They have one of the biggest CF centers in the world. And so we worked with a lot of patients, and I got a lot of experience working with patients and couples that have CF. And through that experience, I really saw some really outstanding outcomes. I mean, I love taking care of this patient population. It's such a grateful patient population. They've got a controlled problem that we're able to go in and fix, but it does require surgery and it does require IVF.
In IVF, we're talking with cells of sperm and eggs and embryos. That's as scientific as you can get in a laboratory, and we're talking about these very tiny microscopic things, but they make humans and life and families enjoy. And so you take a very tiny scientific microscopic thing and you have these beautiful outcomes you can have for people. So to kind of be that intermediary for couples or patients doing that, you really blend the science with the personal, with I think special touch you have to have as people are on this journey too. So it's very easy to kind of have all of my both intellectual but care goals and how I love my day-to-day, because you can put both of those together really easily. So for women with CF, oftentimes their fertility may not even involve needing things like IVF or IUI. It's more so making sure that they're healthy enough to be pregnant and carry a pregnancy as well. CF itself has affected their health with either nutrition, diet, their lung health, and their bodies aren't able to ovulate or release an egg because of some maybe nutritional deficiencies or some of their general health. And sometimes women's bodies will stop ovulating if their body feels they're not in a good, healthy state. So it's more so how CF might affect a woman's general health, and that overall health status would affect their ability to ovulate and get pregnant. There aren't these physical barriers that we typically see in men with CF that cause fertility issues.
What's the urological issue faced by men with CF?
Yeah, I mean, the main one is that they don't have a vas deferens.
Yeah.
It's a condition called congenital bilateral absence of the vas deferens. And it's basically like being born with a vasectomy. So they have a blockage and often will have normal sperm production. However, some men who have been in and out of the hospital with a lot of infections, maybe if they're post-transplant or have really been struggling with their health, the chronic illness, they may have problems with sperm production as well. But the main thing is that over 99% of men with CF actually have a blockage that can be corrected, but not in a sense that most people think. Like, we can't go in and reconnect it because there's nothing to reconnect. So we have to go in and extract sperm for those men. There's about 5 different ways of doing sperm retrieval. So these can get mixed up because they all have a 4-letter acronym, which is confusing. So there's TESSI, TESSA, PESA, TESSA, micro-TESSI, and this can get kind of garbled up in medical lingo and what people read online. But basically, when someone has an obstruction, like a vasectomy or CBAVD in the case of cystic fibrosis, you can get sperm from the testicle or the epididymis or anywhere, and it's going to be equally good in the IVF process. Typically, in men with CF, we can either get it from the epididymis if they have an epididymis, and they don't always, or the testicle. And so a MESA and or a TESSI, or they're called. MESA is microsurgical epididymal sperm aspiration. TESSI is testicular sperm extraction. The details of this are actually more nuanced and sometimes have to do with patient anatomy. So we really get an assessment like once someone's had an evaluation and an examination. But typically we make a small incision and we get sperm out through that incision, and it can either be from the epididymis or the testicle. For someone that lives here in North Carolina, they can probably just come in, have a basic evaluation like you would with any doctor, and make a plan in a single visit. And then after that, we schedule the procedure, which a lot of people would drive in and drive home the same days. If they were making a trip out of this, we need to make 2 trips, like one for the evaluation and then one for the actual procedure. The evaluation we can do via telehealth, but we can't always get a real specific plan in place until a more precise examination is done. Blood work can be done remotely, so that's not something they have to come in for. But I would like to do this in a way that's like safest for the patient and with the most information. And so coming in and doing just one visit, doesn't always make sense for most people. So you have an evaluation, we do an examination, we do blood work, and we make a surgical plan. And then when the patient comes back, they probably need to come in the day before, get settled, have the procedure, and then stick around for a day or 2 to make sure things are okay before they take off to go home.
So a common question I get is, okay, we have the sperm retrieved, it's frozen, maybe we can place it in the vagina and it can swim where it needs to be, maybe we can do an IUI and place it in uterus and it can get where it needs to be. The type of sperm that are extracted and frozen aren't able to meet the egg in that way. So IVF is required in that instance to specifically put the sperm and the egg together. The benefit of IVF being discussed more just out in the open is that a lot of people have heard of it, they've seen posts about it, they might have had friends who've undergone IVF. So some of the stigma that may have been there previously, fortunately, is getting a little bit better. However, I think because people talk about it, patients tend to think it's much more difficult than it actually is to go through the process. I actually tell patients the medical part sometimes is easier than the emotional part, because the medical part is fairly simple, at least with current IVF. So what a woman would expect to do is use medications, which are the same hormone that the brain already sends every month to pick out an egg, but it's a higher level. So instead of one egg being picked out, each ovary will hopefully grow multiple eggs. Those medications are injections, and that's what people mainly think about with IVF, or all the shots that people do. They're very easy to do because the needle is very, very small, and it just kind of goes in their stomach, kind of near their belly button area. And it feels more like a pinprick than an actual shot that we might think of in our arm for vaccines that go in the muscle. Those injections are about 10 to 14 days in a row. And during that time, women have ultrasounds to look at how well their eggs are growing. Maybe about 4 or 5 ultrasounds over that 10 to 14 day period. When the eggs are ready, then they take a trigger shot, which makes the eggs on a molecular basis be ready. And then 2 days later is when the eggs are removed. The egg retrieval procedure is much simpler, I think, than most people anticipate. It is a fantastic nap. It feels very good. It's pretty quick, lasts about 15 minutes. Women are completely asleep in terms of it's not twilight, they're not holding someone's hand, they're snoring very peacefully, but they get to breathe on their own. Those 15 to maybe 20 minutes it takes, we use a very small needle. There's nothing external, so the needle kind of goes inside where the cervix is. Usually make 1 poke in 1 ovary, take out all the eggs that grew that time, 1 poke in the other ovary, take out all the eggs from there. And those 2 tiny poke holes just heal up on their own and they're not visible. Most patients are here for about an hour that day for the egg retrieval, between getting here, getting changed, going to sleep, eggs out, waking up, and going home. So it's actually a very quick process. So in cases where the man has CF and we've surgically extracted the sperm, and we always recommend their partner get screened to see if they carry CF. In the cases if their female partner does carry CF, statistically when there's an embryo from that sperm and egg combination, half the time the embryo will have 2 mutations for CF, meaning that the embryo or child from the embryo would have cystic fibrosis, the disease. The other half of the time, the embryo would carry CF, meaning that there was one copy that was not affected and one copy that did have the mutation. And those embryos or individuals from those embryos would not have the disease of cystic fibrosis. What you can do though is you can actually test the embryos that are generated from the spermate combinations and know which ones have the 2 CF mutations that would get the disease versus ones that just have 1 mutation that would not get the disease, would be a carrier. And then select to choose the embryos that are just a carrier if the couple would want to, so a child does not have CF. A very common question I get, which is, what's the hardest part of IVF? And I think people think I'm going to tell them it's the shots, it's the hormones, it's the egg retrieval, it's the embryo transfer. And all those, to their credit, are things to go through. It is such a roller coaster because even we don't know how a cycle is going to go for a patient. So we can have all these best predictions of here are your egg counts, your egg numbers, and your levels, but knowing exactly what will happen when eggs are removed, how sperm and eggs will combine, how the embryos will grow, will the embryos stick, those are all things that we don't have a crystal ball on. And so a tough part about going through the IVF process is you go through because there is hope and excitement, but also you have to guard your heart too because you don't know where it will take you to. So it's kind of mixed emotions of being anxious for the result, but also very hopeful for the result, and trying to manage those ups and downs of that journey can be really hard. So one of the amazing resources we have here at our clinic is we have an in-house reproductive psychologist who's able to meet with patients before, during, after their journeys, no matter what type of fertility journey they're on, to give really that extra support of, yes, here's the medical part, but let's support you and how can you go through this journey and still be in a good place, or also to navigate the hard times the best you can too. There's buckets of emotion, buckets of finances, buckets of your physical health, and how do we kind of support all those at once? We have a really lovely counselor who helps do that for us.
Fertility treatment is unique in a sense that it's very expensive and it's rarely covered by insurance. Even when someone has very good insurance, even when they have a medical issue like cystic fibrosis, which is a known cause of infertility, it's still an exclusion. And so it's really an insurmountable cost for a lot of patients. And so for someone to come in like a foundation, like Pete and his team at Filotimo, and provide this resource to patients, contact him and they're going to help. And I mean, how easy does that make it for me? Like when I see a patient and I'm, typically when we're trying to deal with someone's insurance and or medicines or whether they can afford the cost of the medicine or what it's going to cost at the pharmacy, like I want to be able to offer the best for the patient, but I don't really know. Oftentimes I'm giving my best guess as to like whether this will be covered and how much it might cost and whether your insurance may cover part or not. And in this situation, I can say, call the Filotimo Foundation.
You can see them exhale in this really like, okay, I'm covered, whatever I need, I've got it. And so it's really special for a foundation to really be in the intersection of like, here's an immediate need, here's an immediate resource, and here's an outcome, and to really walk people through that and just that stress that people have on the financial side of, this is our dream, there is a pathway to get there, we just can't get there with our resources. And for someone to step in and say, we gotcha. It is such a beautiful partnership, and just the happy tears of relief that people can take that burden off of them and focus on the health part of it too is incredible.
This is the kind of partnership that you just don't see in America, that you just don't see with traditional insurance companies, and that you don't see with really expensive medical treatments. So we value the Filotimo Foundation. I mean, they are like the top. I mean, this is the best of the best.
Ew, dirty. Yeah.
I very much remember meeting Pete because Pete has this energy that is infectious and engaging, and he sees the positive. So he's a yes person. It's, what can we do? There's always a yes, and this is how we'll do it. So I remember my first meeting with him was just this infectious optimism of course we can do it, let's figure out how. And it was maybe an hour or two of just understanding his vision, what he's hoping to achieve, and then really seeing the path of how we could partner in that too. So it was energizing, optimistic, and I still remember where I was sitting at the table across from him as he was sharing his vision for this foundation.
So how this started was I went to my doctor and there was a social worker there, and the social worker said, hey, are you, what's new in your life? I said, I'm married. Well, she said, have you talked to your wife about fertility? I go, what about it? And she said, well, you're infertile. Like, there's no fertility. You can't naturally have a kid. And I didn't comprehend naturally what that meant. It just sounded like I was sterile. And everyone with CF is sterile. So I shut down. I didn't hear anything else they said. And I was almost in shock. And then my doctor at the time grabbed my leg and he said, look, go, leave. And there's a doctor, Dr. Coward, that we send people to. Just go talk to him. What she told you isn't true, but she said it the wrong way. And I don't hold that against her at all. I mean, it was just a conversation we were having, and I eliminated half of it. But that's when I went to Dr. Coward, and he was like, I think we showed up in maybe July. And he said by November, if everything goes well, you could be pregnant by November. And I don't know how, but it worked out that way. We had, my wife was pregnant in November of that year. We got lucky, but.
You had an ideal outcome.
Ideal.
It doesn't always go quite so perfectly in a linear way like that, but a lot of patients come in with a similar report of like they heard about this fertility problem in an awkward way. You know, they got the information from someone that only knew a little bit about it.
Right.
Didn't really know what the treatment options were. Didn't really know the success rates that we have. And so it's often like a lot of coaching initially and sort of backtracking when we meet somebody. I mean, you and I met almost 10 years ago. Little did we know that like you would start a foundation and be able to help so many patients, and through the work that you're doing, I mean, you're really helping countless patients from all over the place.
I always find it on a personal level just an honor to be in this place with couples because it is very vulnerable. It's a leap of faith. It's something that we're all kind of taking together, and to be a part of that journey and to know that someone is trusting that we're going to do the best thing that we can for people, not knowing where that might take us. It's just a really special place to be. And I'm always very grateful that people in this foundation can actually all work together with that too. So for me, in a selfish way, I find it really gratifying to be able to be a part of that in a journey that I know someone couldn't get there without these resources, and to have them and they can access them